Comparative effectiveness research, I think, is taking on a whole new meaning. We are coming to literally a crisis point in the country about the total cost of healthcare. And when you break it down to cancer, which only represents about 5% of total spend of dollars in the United States on healthcare, cancer, the rate of growth of expenditure is as great or greater than any other field. And so when you look at from a mathematical or economic perspective, and you take off your clinical hat, and you realize that level of growth is unsustainable, one or two things are going to happen. And this is played out around the world. One, we're going to have rationing like the NICE system in Great Britain, where you have effective drugs that just we can't afford to give, so we're not going to give them because they're not quote unquote effective enough. Or we could have what I call rational care. And rational care is that you don't do things that aren't helpful. The Goldilocks formula, don't do too much, don't do too little, do what's right all the time. So imagine now you have all these wonderful drugs and drugs that will synergize with the immuno-oncology drugs. But yet, there's going to be the right way to do it and the not right way to do it. So sequencing, combinations, other agents, getting rid of unnecessary things like you don't need to get PET scans anymore. So I think it's very dangerous to focus on one aspect and say this drug costs more than that drug and that's bad, or this test costs more than that test, that's bad. It's a very superficial, potentially dangerous way to look at it. You have to look at, you take the embodiment of everything you're going to do, all the testing, all the therapy, where you do it, and you look at the clinical outcome, which is survival, and you look at the total cost of care. Because maybe if I spend twice as much on a drug, but I'm curing patients instead of them dying of their disease, and you look at the 3-year total spend, that patient's not going to the hospital, they're not showing up in emergency rooms, they're not having second and third surgeries, so actually it's a bargain. So comparative research and comparative analysis, I think, will take on greater importance as long as we look at total spend and total consequence of everything you're doing, and not just this drug versus this drug in regard to cost. You know, an increasing barrier for all of us is cost, particularly for the patients. As people have a greater percentage of copays, and you have these drugs that cost hundreds of thousands of dollars, never mind combinations of these drugs, it's becoming a real issue. And you never, at least as a doctor, want to associate cost and outcome. I could cure you, but it may cost too much. I mean, doctors don't want to ever think that way, nor should they. But society has to. I mean, we can't spend 100% of our gross domestic product on health care. So there has to be, and I go back to this, there has to be a way using information technology where we iteratively improve our ability to extract unnecessary cost. And I use this as an example. In immuno-oncology, I teach our doctors, don't ever get a PET scan again. It's not going to help you. You want it to stay hot. And then if you see it lighting up, what are you going to tell the patient? The disease is still here and it's getting worse, or the immune system. Don't even order the test. Well, that costs money. So you get rid of that. I'm using it as one small example. I think comparative research, predictive biomarkers, so you don't give these expensive drugs when they have no chance of working, when the immunologic or the tumor milieu is wrong for these drugs to work. Precision medicine, that's what we need to embrace, because you want the people for whom it's going to work to get the medicine, and we can afford that. There's no doubt we can afford it as a nation. What we can't afford is wasting money, and that's what we have to figure out. So right now, today, it'd be very hard to engineer the approach to immuno-oncology drug administration to optimize cost utilization, because we just don't know enough yet. But we're going to get there very quickly. This is not going to take 5 or 10 years. This is a year or two away. So during this period, unfortunately, we may spend some money we may not have had to spend, but that's going to change pretty quickly.